Cancer diagnosis is life-changing diagnosis.
This is a disease that affects 1 in every 3 people.
Patients come to us with different questions, and not all questions we can answer.
I had people in my family that just recently passed away from cancer.
Patients want to hear that you are doing your best. Patients want to feel compassion. Patients want to feel hope.
The conventional way to treat cancer patients is sort of a one-size-fits-all paradigm. The patient presents with this type of tumor at this type of stage. They receive this type of treatment. Everybody knows this isn't the best way to treat a patient, but unless you have a mathematical theory underneath the hood, you're left with trial and error. We can't sit over here trying to figure out what's best for the population average, because there is no average, particularly when it comes to something as heterogeneous as cancer. But if you can mathematize the system, then you can predict the optimal way to intervene, and that's what we're trying to do.
Tom is really at the forefront of bringing mathematical modeling and high-performance computing to the fight against cancer.
We try to build mathematical models that describe how tumors initiate, how they grow, and they respond to therapy so that you can predict and then optimize the best way to treat a patient. We try to build these mechanism-based models that bake into it the underlying physics and biology of cancer itself, and then use that model populated with the data from the individual to make a prediction about how that tumor is going to grow in space and time.
We use the data that is already collected for the patient. We use the MRI data.
Things that tell us about, of course, the size of the tumor, the shape, but also how blood flows through the tumor, how the cells are proliferating. These are all things you can get from routine clinical measurements. We've done brain, head and neck, breast, prostate cancer, cervical cancer. We're hopeful that this is something that we could apply to almost any solid tumor.
His group is pushing forward on this idea of a digital twin for a cancer patient.
We've actually built out a computational model of a brain tumor and how it's going to respond to chemotherapy and radiation. And we're now looking at how does the data flow into that model and how does the predictions flow out of the model to influence a clinician like me making a decision about how we're going to modify and adapt the treatment to give the best possible outcome.
To be able to predict how a patient's tumor is going to grow and respond to therapy would completely change the treatment paradigm.
It really opens up the door for us to begin to personalize therapy for individual patients.
We don't have to completely cure cancer to be able to realize small gains that could make all the difference to a patient who is undergoing treatment, both in terms of their outcomes, but also in terms of the experience they have along the way.
If patient can be cancer-free for 10 years instead of 5 years, that's 10 years of life with a family.
You can make it to a grandchild's next birthday. You can make it to the next graduation. You can make it to a wedding. You can see the birth of a child. These types of things are, of course, extraordinarily important. So we hope that our technology can achieve some of those goals.
One of the reasons that Tom has been able to do this so successfully is because of the environment we have here at the University of Texas at Austin. MD Anderson, the Oden Institute, and TAC a few years ago established what we call the Joint Center for Computational Oncology.
Being able to work with people at TAC and at the medical school and at MD Anderson gives us the opportunity to get our research out of the academic ivory tower onto Main Street where most patients get their care. We have shown that we can implement our technology in the community working with the Austin Radiological Associates, so it is the type of thing that can affect cancer patients here in Austin.
The next step is to translate these models into real patient care.
In the next 5 years, we will definitely have done this for one of our disease sites.
We are very fortunate in that our lab is having a large impact on the way that people are conducting quantitative research in oncology.
His passion comes out of both scientific curiosity, but also the passion to actually make a difference.
It's not enough for him to just do excellent research. He wants to go above and beyond and really make a difference in the world.
He truly wants to have impact on patient care.
This is a disease that affects every family. This is going to lead to better outcomes for patients, and that's what gives us confidence, I think, to continue to push forward.